Welcome to Medicine X 2016. This is the Ignite stage. And up next, we have speaking on the voices of change, building a better field through collaboration and innovation. Please welcome to the stage, Jeff Driver. Welcome, Jeff.
Thank you. Well, good morning. Good morning. Yes, participation. I'm right here from campus. I'm with a company called the Risk Authority Stanford. And we have been disrupting and co-creating for 8 years strong. And it's a very unusual thing to do in my space. What is risk management, first of all? Basically, we're about preventing medical accidents and responding to them. Unfortunately, we're not very good at this profession. And that's not my words. That's Douglas Hubbard in a book called The Failure of Risk Management, written in 2009. And you only have to look around to see the failure of risk management. What did we see in the news this week? Samsung phones being recalled because they're blowing up. In the healthcare space, our problem is significant. We've all heard it before. 400,000 people die from medical error every year. If you take the lower end of that estimate, that's 525 people a day. It is the city of Oakland or the city of Miami and so forth and so forth. So we must do something different. And our journey has been to disrupt and co-create. When we talk about disruption, we're talking about turning risk upside down. And when we talk about co-creation, everybody's in. The lawyers, the insurance people, the doctors, the nurses. Most importantly, the patients. The patients are our center. So we started with the question, and I see my colleague here. How might we change the field of responding to medical error? And the first question we have to ask is, why do patients sue? Well, why do patients sue? What's the number one reason? Survey says, to get an answer. Yes, they do need compensation, but strangely enough, when a medical accident happens, the doctors, the administrators, the nurses, they go into hibernation. They don't know how to deal with this. So we came up with a better way. We asked ourselves why patients sued, and we addressed them. So there we go. Again, at the center is the patient. And we surrounded that with two things that seem opposed, but they actually work together very nicely. First of all, we all have values and principles as doctors, as nurses, as patients, as business people, as lawyers. But we also have a business to run, and these things can actually work in harmony. So we created this process for early assessment, resolution, and learning. This is a process that seems very simple. It's not that simple. But what we do within 7 days of a medical accident is we investigate and we get the answers back to the patient. And when the patient's ready for a discussion about compensation, we're there and ready for that. Our results are very significant. This is a chart just showing the frequency of lawsuits. Why do we care about lawsuits? Because if you've been through a lawsuit, you know it is horrendous. It is not a fun experience. It takes years, and you don't heal at all. It is a win or lose proposition. And unfortunately, there are winners and losers. There is a better way. Pearl allows us to address medical error very quickly, learn from it, compensate the patient, and heal the physician or nurse that's been involved in the accident. And we've had great success. We can count on one hand the number of lawsuits that we have now. That's just great. What about the money that's freed up that we don't give to lawyers in the litigation process? Here at Stanford, just our 1,000-bed hospitals, we save $3.2 million every year on not paying lawyers. What do we do with that money? We plow it back into patient safety. Right now, we're working on a zero suicide project with the goal of preventing inpatient in-care suicide in the next 4 years and reducing it to zero in partnership with a partner in the United Kingdom. So that's all great. Finally, I must say the numbers are wonderful, but it's really about the people. And this is not just a United States problem. This is Sir Francis in the United Kingdom. They had a terrible accident, and this was his response. And he basically said, we need to go beyond the numbers and do the right thing by people. So we may not be able to control the outcome, because after all, to err is human, but we can control our response. So if you have the power to go back and join this collaborative, there is a place you can go. It's called the Collaborative for Accountability and Improvement, and you can find it online. I'm the chair of that board. Thank you very much, and have a nice time here.